let's get to the fun. I want to start off by talking about what I call the pros and cons of getting blood work done. And let's start with the cons, because the reality of it is, you do not need to get blood work done. I have coached many world champions in many sports. I've broken world records. We've had incredible feats of performance. We've coached a lot of individuals who are non-athletes and regular people to weight loss and muscle gain and all kinds of improvements without ever taking a single vial of blood. So I want to make it incredibly clear. It is not mandatory or necessary for anybody at all to get blood work done just to have success in performance. Obviously, I think there are strong benefits here, but it is not needed at all, right? In addition, it is expensive. Sometimes, depending on your situation, you may be able to get your insurance to cover some of it, other times not. Even if some of these panels are as low as $500 to $700 or so, that's still outside of a lot of people's pocketbooks. I know it was outside of mine for many years of my life. And so we would need to acknowledge that the stuff can be very expensive, and they typically scale up from there. Furthermore, we don't have measures for many things you feel like are important. I mentioned a little bit earlier the relevance of vitamin B12. And a lot of folks realize and know that that's an important role in energy production. But the reality of it is, and a lot of people will not tell you this, many micronutrients, B12 specifically here, are very, very poorly measured in blood. Right? So really unreliable markers. And so we know B12 matters a ton for energy production and performance, but we just simply can't pull it out of your blood and know your status. It's not really how that works for many of our micronutrients. And so as you're kind of seeing here, another major downside is that your results are highly context specific. So you really have to know what you're doing interpreting these things. And this is why maybe a medical provider is going to look at things differently than someone who's looking at it from the perspective of high performance. And I'll share with you plenty of examples of that later. But as you also saw from the albumin example at the beginning and the vitamin B12 as well, a lot of context and information needs to go into a proper interpretation here. And that's not always possible, again, or affordable or accessible for everyone. Another major downside here of blood is most big blood draws are going to be a single snapshot in time. And so you need to really be able to contextualize and not be prey to false positives, negatives, and outliers and things like that, that can screw with your results and interpretation. Finally here, the biggest battle with blood work is understanding the difference between what's normal or normal for you. And so when we look at research in these areas, we're looking at what's normal across a large population. So it's normal across average 45-year-old men who live in the Midwest, and what's average for cricketers and racquetball players, and what's average for so on and so forth, right? Well, that doesn't really tell me anything about what's normal for you. Physiology is unique, and so while I know what an average person in your sport looks like, I still don't know what is actually normal for you, and that is a really big problem. The good news is I can provide you some information on all these things to help. I'm not perfect, and I can't cover all the ground needed in a single show here, but we can definitely do a lot to at least attenuate some of these problems, and in minimum let you know what battles you're facing so we don't over or under interpret anything. Now, I know that was a lot, but I really did genuinely want to make sure none of you left this thing feeling like you were overly sold on blood work, because I'll be honest with you, the next bit of time I have with you here, it's going to be very convincing. And so I really need to make sure that people understood there are downsides. You don't have to do this at all. Because one thing I've always worked in my career against is making sure we don't overly market or sell or hype something up to a level that was maybe not appropriate or fair without acknowledging the downsides. So pros and cons has always been a big part of my career, always will be. And so I wanted to make that list elaborate and long and truthful. But that being said, let's flip the script here and talk about the benefits of it. The very first one is that there is a deep evidence base for what's called blood chemistry. Now, you're going to hear me say that basically the rest of the show. That's what we'll often refer to. When you get blood work done from the perspective of health and performance, most people are going to refer to this as a basic blood chemistry or an advanced blood chemistry. So that's what we mean when we say that. And there is an enormous, and I mean enormous evidence base for this. You've got, again, thousands of markers with decades of data on them in America and Australia and Europe and Asia and all over the world. And so we really do have large amounts of quality data to go after. And especially if you can compare this and contrast this to things like a sweat test or a saliva test or a hair test, the information available scientifically gets way smaller. So blood chemistry is very, very, very well established and has a lot of information you can go back on. It's also able to help you solve very specific problems. And so if you go in thinking you've got a hydration issue or a cramping or a fatigue or feel like you're plateauing with muscle growth or you feel like something specifically is going on, blood chemistry lets you go right after that. And if you know what physiological processes are a part of those areas, then you know what to go test. And so it can really help you pinpoint whether or not an issue is going on in your physiology or whether it's maybe due to your nutrition or your training or some other factor that's not physiological. Another major benefit is it lets you know why things are happening, not just what is happening. And so again, if we think about hitting a plateau, like we've talked about in other episodes of this show, or you've had this drop in energy or functionality's gone down or whatever else is going on, well, if all you do is say do a performance test or a body composition test, you might know that you've lost some muscle, but you don't know why. Well, the blood work is going to tell us why for the most part. We're at least going to see the physiological reaction, and that's going to give us insights about what to do to go solve it. So high precision information about what's happening for more high precision solutions. On a similar note, it lets you differentiate symptoms versus causes. A really, really important thing, and as you'll see later, and I'll highlight a bunch of times, just because an area is symptomatic doesn't mean necessarily that's the place you want to target. You want to find out what's causing the symptom and then go back and solve that or address that. That not only actually gets you the correct solution, but in large part, if possible, when possible, it allows you to stop the problem permanently. Not always possible, but is sometimes. And I think most of you would agree here, almost always we'd rather solve the core of the problem if we can, rather than just continually cover up the symptom. Blood work gives you that possibility at least. Another major benefit we've used over the years is the fact that it is objective, meaning it doesn't care if you had a great day the day before. It doesn't care if someone is worried about hurting your feelings or not. It's not subjective like that. It helps you solve the problems that you need versus the ones that you want. So really helps us know what to solve versus the one you think you need to solve. And then finally, and perhaps my biggest point, is what I'll call a baseline or a passport. Now you heard me refer to this a second ago when I said one of the major cons is differentiating normal for you versus normal against the average population. The only way we can really understand what's normal for you is if we have multiple draws from you. And so a lot of things I actually tell people is like, hey, your first time getting really good blood work done, you may or may not get a lot out of it, but that's okay. The real value is starting to understand your baseline physiology. We have to understand what's normal for you over time. Now, this is critical for things like aging. The easiest one to pick on here is testosterone. A lot of individuals, particularly men, but plenty of women as well, when they start getting into their 30s, 40s, and 50s, get excited about using exogenous testosterone. That's fine. That's medical. That's not in the scope of this conversation. But they do that because there's a lot of information now about how testosterone levels have declined over the last, say, decades. True or not, don't really care. My point, though, is saying, hey, look, you think your testosterone is lower now. All right, great. Well, how do we know if that's just normal for you? I don't know what your baseline was. And so by starting your blood work, say, in your early 20s, and then when you get to your 30s, you actually know, hey, for the last 10 years, I've been at 400, for example. And now all of a sudden I'm at 250. Okay, clearly testosterone's gone down, and now your medical provider can choose to do what treatment option they like. But if we don't know that baseline, we don't actually know, maybe 250 was normal for you. Maybe that's been your whole life, but your symptoms have only started 2 years ago. If that's the case, your symptoms aren't being caused by your testosterone if that's where it's been the last 25 years. We need to understand what's normal for you over time, and the only way to do that is to have some routine blood work done. And last one then is progress tracking, of course, right? If you're doing something and you're working on your sleep, you're working on sunlight exposure, having better relationships, eating better quality food because you think it's going to make you healthier, which it should, well, having some blood work done will give you a lot of objective markers about, hey, it's working, or it's not. Or you tried a different supplement regimen or whatever else has happened. You don't really know if it's making a physiological change unless you have a physiological measure. So hopefully that gave you a lot of information about some of the benefits of routine and high quality blood work. And so if that has happened and you're all fired up and you're like, I'm in, I'm so in, Andy, now just give me the goods. It's time to do it.
If you enjoyed this clip, you can watch the full episode by clicking here.